MACRA and Rural Healthcare. Thanks for joining us today. I'm Angie Yazelitis, and I'll be your facilitator once again. As always, we're very excited to bring you this workshop as you round out the fourth quarter of 2016. So let's get right into some housekeeping to kick off. Today's workshop will be presented in a Q&A format, and that really gives our presenter an opportunity to expand on some key points and then involve the attendees. This is designed to be a more basic workshop, so if you feel that you're more advanced in this topic, we will be opening up for additional questions at the end of the session. And Angie really is happy to get a bit more in-depth at that point. So please get engaged and use that feature on your GoToWebinar panel. We will also follow up with all registrants and all attendees to answer any questions we may not have time to address. And we will be providing a certificate of attendance to anyone who may be using this for continuing education units. Lastly, this webinar is being recorded, and we'll provide that link to you in our follow-up so that certainly you can share that information with any other members of your team. I'm very proud once again to introduce you to Reclamere and to have back our expert speaker, Angie Keating. For those of you who have joined us before, you know that Reclamere is a leader in data security, data destruction, offering a full range of specialized IT asset management and information security services, and that they offer several educational opportunities throughout the year. I won't go into Angie's full bio because many of you already know her or attend our workshops regularly. But as the CEO of Reclamere, Angie has a broad and diversified background with over 20 years of experience, specializing in computer forensics, data destruction, security incident response, information technology risk management, and systems auditing. She provides consultancy in e-discovery and litigation support, forensic analysis, data breach response, notification and compliance, and certainly compliance and risk management services. Angie holds multiple certifications, and certainly you can see that on the screen. She's actively involved with the National Association for Information Destruction, or NAID. She also sits on the board of the directors for the Ben Franklin Technology Partnership and proudly serves as adjunct faculty for the Pennsylvania Bar Association, or the Pennsylvania Bar Institute. And that just names a few of her activities. She earned a degree in electrical engineering technology from the Pennsylvania State University. So thanks again, Angie, for taking the time to be with us today. I know you're joining us in your travels, so we truly appreciate it.
Absolutely, and I've done my own housekeeping since I'm not usually on the road when we do these, but I have the do not disturb on the hotel room door. I've even unplugged the alarm, and so hopefully I'll keep my fingers crossed. I won't have a knock on the door from the maid.
Oh, I think we'll be good. So, excellent. We're excited. We're going to get started. We'll be covering key points concerning MACRA and its impact on, or certainly its relationship to, data security. So with that, I guess, Angie, let's just kick it off. Can you start by talking in general on where MACRA originated and its relationship to HIPAA, if any?
Sure. So on April 27th of this year, the Department of Health and Human Services issued a proposed rulemaking about implementing key provisions of the bipartisan Medicare Access and Chip Reauthorization Act of 2015, known as MACRA. And this was to modernize and streamline Medicare and tie payments to providers based on quality of patient care, not volume. So what we're going to detail today is going to focus on something that is part of MACRA called the Merit-Based Incentive Payment System, also known as MIPS. And we're going to focus on a very specific category of that called Advancing Care Information. And this is just one portion of MACRA, which is quite complex. It will replace meaningful use for physician practices, and it is one component out of 6 different areas. And the reason for our webinar today is because I'm concerned that physician practices may be focusing on the big component of this, which is the quality of patient care and how they're going to measure it. And obviously this is incredibly important because it accounts for 60% of the scoring that's going to be used for how physicians will be reimbursed in the first year. However, cost as well as improvement activities are other areas of this. And one specific area that we're going to focus on, advancing care information, is 25% of the score for the next 3 years. So that is Congress's way of saying that the portion of advancing care information is absolutely crucial, and it needs to be in place right from year one and is going to account for 1/4 of the overall score under this reimbursement program.
That's interesting. I think, you really hit the nail on the head, because in our research we found out pretty much everyone in healthcare knows about MACRA, and like you said, it has to do with so much more than security, and that so many people think that security is a small part of the overall rule, but it's such an important one. From what I found out, it starts with the requirement for a security risk analysis. So can we start there? Can you teach us about that? And how is that different, if it indeed is, from other risk assessments an organization may already be doing?
It's not different at all. The only difference is the fact that as part of the MIPS program, it is required right off the bat. Whereas with HIPAA, people kind of got used to, or with meaningful use, there was kind of this, well, there's phase 1, there's phase 2, kind of sometimes there would be extensions, kick the can down the road. This is completely disruptive. And it was meant to be, because it was basically Congress's way of saying, we are going to get healthcare information interconnected, we are going to do it securely, and we are going to provide this information to other caregivers, to other types of databases such as health information exchanges, such as state immunization registries. All of this information must be interconnected so that it can ultimately be used to improve overall outcomes for all of us, thereby driving down the costs of healthcare. So it doesn't change the fact that you have to have a risk assessment, nor does it change the kind of risk assessment that you have to have. But what it does do is say that by January 1, when you begin to report, whether you choose to report for a full year to try to get the maximum reimbursement, or whether you're going to do the partial for the 90-day reporting, the number one, very first thing that is a requirement straight off the bat is that you have performed your security risk assessment in your practice.
Okay. Interesting. And, we did a workshop, well, I guess it was a couple weeks ago now, and, Connie talked about that vendor management is an important piece of this. So how does vendor management actually sit within the SRA?
Well, vendor management is a very, very important component of the security risk analysis because, and I'm using analysis and assessment interchangeably, it is a significant portion because depending on the data that you look at, whether it is the data provided in the OCR's own wall of shame, whether it is from other industry reports, 60% of the records that are breached through healthcare have a direct tie in causation to a vendor that the healthcare provider has chosen. So it used to be in the old days that when you got a business associate agreement signed, filed away, that was considered good enough by many people and many attorneys that was good enough that you could check off the box that you had performed your due diligence on your vendors. I can tell you from working with clients on security incidents and breaches that the business associate agreement is a wonderful thing after the fact when everybody gets ready to sue each other. But I can tell you that when the security incident happens, that business associate agreement has very little to do, unless it is crafted in a very specific way, to force your vendor to do certain things, such as notify you of the event within specific time frames. Does your vendor even have training in place for their own people? You know, there was just a very significant data breach that happened in Philadelphia assisted living facility, where their managed service provider, the folks who took care of their computers, lost an unencrypted device. And it's resulted in a $600,000 financial settlement with that business associate, that vendor, to have to pay. And so it is absolutely crucial to understand that not only is the Office of Civil Rights looking at the covered entity, the healthcare provider today, they are also looking and conducting audits on the vendors, the business associates who provide support services to the physicians, the hospitals, clinicians.
Interesting. It's crazy to hear those types of fines. You know, when we were doing research on this particular workshop, we found some folks discussing online this requirement around secure messaging, which, you know, obviously secure messaging is something that I'm sure healthcare practices think about regularly. But
sure.
What is that? And does MACRA actually raise this in importance or priority?
Well, MACRA is really going to, in my opinion, have the potential to significantly increase data breaches in small practices. And it's really important to understand, if you are a small practice or you're a single physician office, that you are not flying under the radar anymore with the Office of Civil Rights. In fact, a couple years back, they made it a point to make an example of a small cardiology practice in Phoenix by really kind of nailing them to the wall in terms of corrective action and fines, because of the fact that they were a small practice, to send that message that you must keep your information secure. Many, many healthcare organizations have privacy down. They do it well. They know what it means. And I think that's because it's drummed into every medical professional, healthcare professional, clinician, or administrative support. Anyone on the planet who works in healthcare understands privacy. We have to keep the information private and confidential. But that does not equal security. So you can have the most private office where everybody keeps patient names covered up, and they have the screen darkeners, and they turn papers over, and they understand what to talk about and what not to talk about. But if your systems, your IT systems, have not been tested and validated that they are secure from ransomware, from other types of keylogger attacks, then you don't have security. And thereby, your best practices in privacy can completely be obliterated by one event of malware into your system. And so to bring it back around to secure messaging, you know, one of the really important areas for the practitioners under MACRA that are participating in the MIPS payment is that secure messaging is a requirement as part of the coordination of care through patient engagement. So it is believed that when patients can chat or send secure messages back and forth with their practitioner, with the office to get results, or for the office to check in with them, that the patient is more engaged, and a more engaged patient will have more successful outcomes. They will have a lower chances of readmission because they are engaged with the practitioner and find out issues early. That secure messaging, if it is not already part of the practice, has a very high potential to be another point of entry for security incidents in your organization. If you're already using secure messaging, it doesn't matter if it has been designated as quote unquote HIPAA compliant. There is no true meaning behind HIPAA compliant. If the systems that facilitate the secure messaging into your own network, into your own mobile devices, has not been tested, then you could have a quote-unquote HIPAA-compliant secure messaging platform, but where it connects into your own systems may be completely wide open to outside attacks.
Okay, that makes sense. And I think that one of the things that you hear is that specifically for small and rural healthcare practices, like finding those vulnerabilities, really dotting your I's and crossing your T's, excuse me, can be a burden for a smaller practice, but it has to be done. And I think when you weigh
it absolutely
that
does.
burden, yeah. So can you talk about that and like what weighing that burden versus what the objectives and measures of MACRA really are and why they're doing it?
Well, the most important thing about MACRA is not to let fear, uncertainty, and doubt drive your decisions around budget, what systems you're going to implement, or to kind of fall victim of the one-size-fits-all approach. One of the great things about the law is that it did not come out and say that a physician practice had to meet every single requirement immediately right off the bat. There is a phased-in approach where organizations will not be significantly penalized until the year 2018, and that is if they choose to do absolutely nothing. So, most of healthcare practitioners, professionals have gone through higher education, and coming into compliance with MACRA is no different than getting a degree. You didn't start the first year and kind of skate by in your medical school and then expect that years 2 and 3 you were going to have great grades and everything was going to go well and you would not suffer penalties because of slacking off in that first year. So within MACRA, this first year is really about collecting information, and they give you ways under the 6 different objectives, which are protect patient health information. The way that is measured, and it is required, number 1, is that you have a security risk analysis. The second objective is electronic prescribing. And the way that you enable that is through e-prescribing. The good news about this is that you're going to get a score one way or the other, whether it's yes or no. The fact that you simply collect the data is just super important. Patient electronic access. So that is patient portals, patient access to their information, as well as patient-specific education. So things like different types of condition awareness, diabetes, nutrition, those types of things. Again, these are things that they may be selected as part of your score, but they're not required in this very first year. Coordination of care through patient engagement. This is where we talked about the secure messaging. This is where we talk about things like they can view, download, transmit information. And then patient-generated health data. With that phasing in. Hello, are you there?
And you cut out just for a moment. It's okay though, you're
sorry.
back.
Yeah, so with that, again, with the patient engagement feature, you can select these items. And, at Reclamere, when we come in and work with a client, we are all about the quick wins. So we may have the ability, you already may have the ability to view, download, and transmit information because you're using encryption and things like that. That's great. You may be further along under MACRA than what you even realize. The health information exchange. This is an area where a lot of small practices especially have struggled because it is required under the MIPS objectives through MACRA that you are going to provide information to other physician practices, that you will be able to exchange information with for clinical reconciliation, and you will also be able to exchange information with your patients. And so, again, this exchange, you may have a platform to facilitate the operational exchange of information, but doing that in and of itself creates a vulnerability in your IT environment where you will actually have an entry point of potential security, malware, keyloggers, those types of things, where that new entry point presents a risk. That risk must be analyzed, it must be assessed, and it must be addressed. And then finally, the last objective is public health and clinical data registry reporting. So this is where we talk about immunization registry reporting. This is required. So this, just like your security risk analysis, needs to be super top of mind. If you're not already doing immunization registry reporting, you want to really focus on this and that risk analysis within the first 90 days of the year 2017. You also then have many different optional items under the data registry reporting, such as syndromic surveillance reporting, electronic case reporting, public health registry reporting, and clinical data registry reporting. Again, these are optional, and these are items that can be.
Angie, you cut out a bit there again. So I just am testing audio here.
Am I still there?
Yeah, you're here now.
Yes, I am so sorry to all the attendees. I know this is.
No, it's okay. You're cutting in and out. Are you back? So I just want to, I'm not sure what's going on with the audio, so I do apologize. I do know, as we're waiting for Angie to come back on, that one of the things that we want to talk about is really what can be done on lowering the burden for the smaller practices. And one of the things that I know that Angie's going to talk about is exactly what she started going into, which was really creating and having a plan in place. So
that's correct,
I'm going to pause.
Ange.
So there she is, perfect timing. So we're going to have her talk about that. Thanks, Ange.
Yes, I am so sorry to everyone who is on the call. So how do we lower these burdens? Well, one of the great things is that for those who have been working very diligently in complying with meaningful use, who have already looked at things like e-prescribing, who have already implemented maybe some things around secure messaging, or you have already taken some of these steps, it's really important to sit down, understand the features that your own technology may already have. I go into organizations and I sometimes see them and they'll have this great system and they're only using 1/10 of what that system can do. So maybe a platform that you've chosen for your electronic health record system, your EHR, actually has secure messaging. You just simply haven't turned it on, or maybe it's an additional module that you purchase. So that's a great way for you to sit down with an expert in compliance and how technology and compliance work together. It's important to understand that this is not operational IT. This is not how your computers talk to each other. It is not how your antivirus works. It is not which firewall you use. It is a very different discipline of making sure that not only is your technology secure, but that your business processes that use that technology are compliant with the regulations and are going to help facilitate all of these objectives that you need to meet under MIPS.
Okay. I know in our last workshop we talked a lot about how it can often be best to partner with someone And we talked about that specifically the last time on vendor vetting. But does the same hold true for the security risk analysis? Does it have to be done internally? Can you partner with somebody? Can you talk about that?
Yeah, absolutely. It absolutely can be done internally. If you are a very large organization with a very robust information technology and compliance group that really understands how those two things work together, then you absolutely can do this on your own. If you are a smaller organization, maybe a mid-sized organization where you have some IT folks on staff, however, compliance and how the business processes, compliance and technology all need to work together is maybe a little bit of a missing piece, then a partner like Reclamere can work with your own IT team to really help everybody work together in their areas of expertise and make sure that everything is compliant, meets your business objectives, and then also is the right technology with your budget in mind and all those kind of things. And then finally, if you are a small practice and you outsource all of your information technology to another party, that's also an area where you want to be careful that you don't have a conflict of interest where the people that have installed your technology are the ones that are also auditing and testing that infrastructure for vulnerabilities. It's really attractive because many of these organizations will tell you, well, we'll do your security analysis for you. That is a big conflict of interest where you have the fox guarding the hen house. And I have seen situations, one very recently actually, where when there was a ransomware attack, that managed service provider that maintained the servers and the computers and all of that kind of stuff turned around and blamed their own client when it really, the burden of why that root cause happened had a lot to do with the services that the managed service provider should have been supplying but was not. So the role that a company like Reclamere can play is very similar to your attorney, where we can look out for your best interest and really make sure that we're holding your managed service provider accountable, that not only are they implementing technology that they're selling to you, but we can also test it, we can also perform the risk analysis and come back to you and also go back to them, because we want to work hand in hand with them. We don't come in, or we don't replace them. We don't do any of those same things, but we can help them facilitate maybe upgrading equipment, upgrading software, and so we can be a valuable partner to those service providers out there that understand the conflict of interest and want to make sure that they're delivering the highest service to their clients from a compliance perspective.
Okay, certainly seems to make sense. In our digital research, we were finding a lot of conversations going on that were offshoots to MACRA and security risk analysis. So things like employee training and system considerations, which you kind of touched on. Are there particular areas that you feel organizations need to be discussing outside of what you've already covered with MACRA as it applies to security?
Well, part of your risk analysis, I mean, I can kind of give you the big three areas that we will almost always find weak when we are looking at healthcare practices, group practices, anything outside of a hospital setting, just simply because there are fewer resources. But number one, we will see very poor staff training. They will do an excellent job training staff as it relates to privacy. However, security training tends to be non-existent. Security training under the HIPAA security rule is an absolute requirement. So making sure that your staff understand not to click on links, not to download attachments, what they should do, how they should respond if they happen to accidentally do that, who they need to tell, how they need to do that. That's super important because one of the biggest things that's happening right now in healthcare is this ransomware epidemic. And the root cause of most of this ransomware are the end users, the staff, clicking on links in email where they have been targeted, and those links then release the malware into the ecosystem of the information technology assets within the practice. That's the first area. The second area where we almost always see weakness is in the business resiliency. So one thing I know when I see a headline talking about a healthcare practice that has had a ransomware attack where they were rendered dead in the water, they couldn't even function with their computer systems, is I know two things. I know, first of all, that they had poor or non-existent security training because of the fact that somebody clicked on something. And I also know that their business continuity and disaster recovery had not been updated and probably only took into account things like floods, fires, earthquakes. But if your business continuity, if you don't have business continuity and disaster recovery where you have, real-time backing up and you have an ability to return your operation to functionality quickly, then I know that you probably have not updated your business continuity and disaster recovery plan in a very long time, or you simply don't have one. These solutions have come down significantly in price. The other thing practices need to understand that just because everything is in the cloud doesn't mean that it's always available. There is a mechanism by which your machines connect to that cloud. And if, for example, you have an Active Directory, if you have a domain controller, I'm getting kind of in the weeds here on the tech side, but if that domain controller ends up being the device that's encrypted, your employees can't reach the internet, they can't reach the cloud. So you are at that point in time effectively dead in the water. And then finally, the last thing that we see is a really big over-reliance on antivirus. Clients think that if they have antivirus installed on their machine, that they're protected, they can do anything on those machines. Antivirus is very much like the flu vaccine. And healthcare professionals understand this because they know that the flu vaccine is designed based on known viruses. And if you happen to get exposed to an unknown variant of that flu, even though you've had the vaccine, you can still get the flu. The flu rapidly changes, there are different variants. Well, it's the same thing with antivirus. Antivirus is very good at stopping and finding malware and viruses that it already knows about. However, virus and malware can rapidly change and it can morph into a variant within seconds that, even though it is similar, your antivirus can't recognize. Well, there are all kinds of great next generation endpoint protection where in real time the ability to analyze this behavior can morph to be able to find these types of things. So it doesn't replace your antivirus, it is an additional layer of protection. And the HIPAA security rule requires that you have proactive protection of these endpoints of your computers. Antivirus, traditional antivirus, is a very reactive tool to stop something once it has been found. It's reactive after the fact. But great solutions now for protecting those endpoints in real time in a very proactive way to be compliant on that one technical control.
So I guess my follow-up to that then is that next generation, technology expected kind of as the proactive piece.
Absolutely. And the other great thing about that is that when that is in place, our engineers can be able to very quickly determine whether or not a security incident is a reportable breach. Many people that have had ransomware attacks and have spent tens of thousands of dollars on forensic investigations know that it is like finding a needle in a haystack, and oftentimes, even after the best forensic analysis, it is still undetermined whether or not that malware actually touched patient health information. With these real-time tools in place, it's almost like you have a forensic investigator watching your network all the time. and we have the evidence to be able to definitively say yes or no whether or not it touched patient health data. And that's super important. That's the difference between having to report a breach and simply having a security incident where you definitively know that it did not touch patient health information.
It's so interesting. Okay, so Angie, as always, you have impeccable timing. Because this is a workshop, we really wanted to allow at least 15 to 30 minutes to interact with the participants. So I'm going to go ahead and transition to that. At this time, please submit any questions you might have, and I'll get started. Like I said earlier, if we don't get to them, we certainly will get back to you. So here we go. And we have we're a small healthcare organization. My IT and compliance team says we are thoroughly prepared for MACRA for this topic. How would you respond to that, and how can I be sure?
I would ask them to provide to you a copy of the most recent security risk analysis report that they have performed, and to also provide the working papers documentation that they used to validate that report. A couple things will happen. Best case scenario, they will hand you the report and all of the working papers, and they will have been absolutely right. Worst case scenario, they're going to look at you like deer in the headlights and say, well, we don't need all of that. We know. That is a gigantic red flag that your IT people are not speaking and understanding compliance, and they don't understand auditing. That is not to say that they don't know what they're doing with your operational IT. They may be the very best in the world. But just like you would not want me to configure your firewall, you may have IT people that do not understand what an auditor from the Office of Civil Rights is going to look for and require. If that information is not written, documented, and you can't prove it, it does not exist. It doesn't matter what your IT person tells you of what they do. If they can't prove it, that is a problem. So I would suggest in that case, or even if they do give you a report and you just want to get a second opinion, we can do a telephone desk audit with your IT staff and ask them the questions that you need to feel confident that you are fully ready for the security risk analysis portion.
And I'm just giving you the heads up that you're cutting out again there, so that you're aware. So what we'll do while we're waiting is we will give Angie a couple of minutes to come back in there with her sound. But if for some reason she doesn't, again, we do apologize because she is in a hotel room, but we do have 3 or 4 questions here, and what we would do if she hasn't come back in here in a few minutes is we'll provide those answers out to you all.
Angie, I am back. I apologize. I don't know why I continue to cut out. I have great service here, so I'm not sure what's going on.
Okay. All right. Well, welcome back.
So at what point did you lose me?
You were just finishing up that how you would work if you were going to do a desktop audit with them.
Perfect. Yes, exactly. And that's a really basic, simple thing that we can do in 1 to 2 hours. Very, very low cost, and you can really get an understanding of where you are.
Okay, perfect. I think this is a great question that came in. It says, I'm confused. It seems like with our vendors, like our technology vendors, at least part of the security risk analysis, they would have a responsibility to take the lead on this. It seems like it could be overkill on our part to do vendor management if they have that same responsibility to do this as well. So who takes the lead?
Oh, at the end of the day, you, the covered entity, are responsible for the vendor that you chose. Under the final omnibus rule, you as the covered entity are responsible to make sure that your vendor is in compliance by performing due diligence. So just like when your internal staff says, yes, we're compliant, you need to ask the same basic questions of your vendors. Do you have an incident response plan? Do you require encryption of portable devices? Do you have a security training program? When was the last time you did your security risk analysis? If they don't know what you're talking about, or they can't answer every one of those 4 basic questions, then you have a problem. The other issue is not holding your vendors to particular, specific, appropriate benchmarks and standards. So I see technology people or technology providers saying, oh yeah, we keep everything secure. We handle all of your patching. How often? If that technology provider's idea of patching your systems is whenever they get around to it, or whenever they think it's okay to do it, that's not appropriate. That doesn't even fall under best practices for any of today's security requirements under standards such as NIST, the National Institutes for Standards and Technology, which is the underpinning of the technical requirements for HIPAA. It doesn't fall under anything under ISO or SANS or any industry recognized reputation based standard. And so those are the types of things that need to be in your contract. You need to have contractual obligations. You know, the client that I told you about has very little recourse on their ransomware attack. It happened because of an unpatched system. Well, if that service provider had been working in accordance with some type of baseline security standard, then they could have been held accountable that it took them days or weeks to patch a system that could have prevented this incident.
Okay. So this kind of goes off of that same question, I think, and we got this question in the last workshop. I asked for some clarification in our agreement with our vendors regarding security, and it came from a meeting on MACRA. I'm getting a lot of pushback. What do you recommend? And I guess that's what do you recommend if the vendors are pushing back?
If your vendor is pushing back when you're asking legitimate questions about security and security validation, you've got the wrong provider. There's no other way that I can put it. You know, and that person would be a great candidate to get our free vendor assurance questionnaire that we have sent out in the past. 10 basic questions that you need to be asking your vendors. And if their contract is anywhere near up for renewal, or you have any type of 30, 60, 90-day out clause, that's your leverage to say, come in, sit down for a meeting, we're going to go over these things. And it is not enough for you to tell me that you have a patch management program for my organization. You need to show it to me documented in writing, and then I want to see proof that you're complying with it. I want to see proof of when the last time was you patched my systems. I can't tell you that I harp on patch management because too many IT people have this antiquated notion that patching systems might break them. So they wait and wait and wait, thinking they'll just wait until they know that the patch is safe. Well, that's an antiquated notion because very few systems break anymore after they have been patched. Unless you are in a very large global organization using legacy equipment, patches do not tend to break systems anymore. If you are in those situations or you're even worried about that, it's simple enough to have a very small sandbox test environment where your IT provider should be rolling out those patches and testing them and making sure that they're okay. So it's not okay for them to give you pushback because at the end of the day, even if they are responsible for the data breach under HIPAA, you're still going to get sucked into the investigation. And if the reason for the breach by the vendor is reasonably foreseeable, you could have asked the question, do you encrypt portable devices? Then you're negligent in asking them the right questions to know that they did that. You know, one of the biggest fines for a business associate just happened in Philadelphia. It was an assisted living facility organization, and their technology provider that manages their IT systems, updates them, sold them their systems, they lost an unencrypted portable device. The Office of Civil Rights has entered into a settlement agreement with that vendor for over $600,000. If you have a small technology provider, I really would hope that they would have cyber insurance to cover that, because they may just simply go out of business, leaving you holding the bag with all of your systems. Or what may happen now, and we don't know, is that I'm guessing that the Office of Civil Rights is now investigating most of the clients of that technology vendor, because the selection of that vendor, there was no vendor due diligence if this was allowed to happen in the first place. So these are the kind of considerations when you think, well, they're responsible to do it, so they will. That's not the case, unfortunately.
It's interesting. It's like it's a ripple effect. One person gets investigated, and then everybody else who somehow touched them gets involved. It's what it seems like to me.
Yes, you're absolutely right.
It's interesting. Okay, so here's a good one. I know that I have to complete, questions as part of the whole process for payment under MACRA, but do I have to complete the security risk analysis annually and keep it on file? Is that something I have to upload? But it seems that that's more of a process question.
Yes, it is a practice question. You have to attest to it. So as you're going through and you're preparing your data, whether you're going to submit year-long data, you're going to submit just for the 90-day period, that will be a requirement that you'll have to attest to. You have to say, I do have this in place. Now, understand, a risk analysis is a one-time deal, but the remediation of the risk analysis is just as important. So if you have a risk analysis and then you just put it on a shelf, and let's say the findings were that you needed to implement a staff training program for security, you needed to beef up your or actually develop an incident response plan, so forth and so on. You put that risk assessment on the shelf, and then next year come back to it and you say, well, nope, we haven't done that again either, but we've done our risk analysis. That is very bad. And if you have an incident and that deficiency has been on record and you did nothing about it, that's a big problem. Now, HIPAA and the enforcement of HIPAA, they understand that there are business constraints, there are budgetary issues, but you have to show the effort that you are considering these items, that you are working towards coming into compliance on these items. So doing nothing is always bad. Doing nothing by not having the risk analysis done is bad. Doing nothing after you get the risk analysis to remediate your issues is also bad. OCR expects that your risk management is an ongoing daily function of compliance. It's like infection management. You don't just deal with infection management once a year and say, yeah, we're good. You deal with it every single day, in every way, in every process and procedure that could impact how your organization manages infection. Security is no different. It is exactly the same, and it needs to become an ingrained part of your culture to be HIPAA compliant.
Okay. Looks like these last two questions I have are directed more towards Reclamere specifically. So are you, Angie, already working with any rural healthcare organizations as to how their current security processes may impact MACRA and them getting paid?
Absolutely. In fact, regional healthcare providers, small practitioners, they really are not only our biggest client sector, but they're one of my favorite, because I do appreciate the fact as a small business owner that resources are precious and scarce, and that the expectation by most in the health administration area around finance is that MACRA is going to impact your bottom line. How you spend every single dollar is absolutely crucial. And so it's really important when I go into an organization that I want to understand, how can we improve the systems we already have? How can I get the easy wins? How can I work with their technology provider to improve the service offering without increasing cost? I get it. I understand it. And so, yes, we absolutely are working with those organizations, many of them by virtue of meaningful use. And I will be very honest, we acquire a lot of clients through their attorneys telling them to call us after a security incident. I would love nothing more than to have the significant portion of our client population be people that we work with proactively before they have had an unfortunate event. The data breach, security incident, is a resume generating event for many people that work in health administration or work in practice management or work in IT. You do not want to be the victim of that resume generating event. So I would much rather work in a proactive fashion with our clients to keep my clients out of the headlines. I don't look at compliance as a box you check. I look at compliance as the outcome of preventing data breaches. It's that simple. That is my most important measure of success, is that our clients stay out of the headlines.
Yeah, absolutely. I think you answered this last question, but I'll ask it anyhow. Angie, do you work with companies through the entire process, from security risk analysis to vendor management and beyond?
Absolutely. And Reclamere does not take a one-size-fits-all approach. I'm very proud of the fact that 9 out of 10 of our clients that engage us for a risk analysis choose to retain us to help them through remediation. And I will tell you, a significant number of those are now in their second and third year of continuing to have us work with them in the form of helping them through their remediation. Sometimes we do a small engagement where they're getting ready to apply for cyber liability coverage and they want us to help them complete the questionnaire. Some clients decide that maybe they'd like to buy a block of hours so we can help them write policy and procedure. Other clients decide that they want to have us on basically a monthly retainer where we are their virtual chief information security officer. We fulfill that requirement to help their designated security officer, which they must have under HIPAA, just like they must have a privacy officer. We really help them to be that outsourced counsel to them as it relates to their technology. At the end of the day, your data today is your currency. And for the same reasons you have a CPA and an attorney to protect you financially and contractually, that's why you need expert security consulting to protect you from all of these pitfalls around your data.
Yeah, and I follow up to that for whoever asked. I mean, certainly the phone number to Reclamere is on the line, but in our follow up, you'll have some direct contact information, so we can have some dialogue if you want some more information on that. So I think we'll go ahead and stop there with the questions, because I don't see any additionals coming through. As I said the last webinar and this one, we sent out the recording. We will send a proof of attendance certificate if you need it or would like to use it. And obviously Angie would love to engage with you if you do have additional questions that you just weren't comfortable asking, or you just want to have further dialogue. We would love that. So Angie, I'm going to stop there. Is there anything additional you would like to add before we wrap up?
Yes, I would like to sincerely apologize to our attendees. This is not our normal quality of webinar with our telecommunication issue and me being 1,000 miles away in a hotel room on a cell phone. So I sincerely apologize. I know we had a very large group sign up to be on this webinar, so I really kind of flip-flopped back and forth between canceling and rescheduling. but with the turnout, I really knew that this was a topic that people wanted to know about. So I hope you'll please forgive us for the technical difficulties, and I'm very happy to talk with anybody one-on-one if they didn't either get a chance to answer their question, or if there was an area where I was speaking and I fell off the call that you didn't get to hear.
Yeah, I echo that. So we will personally reach out to each of you and just thank you for your time. Everybody have a wonderful afternoon. Thanks, Angie. Thanks to all.
Bye, Angie.
Bye.
Thank you. Thank you so much.